The latest numbers for the deaths and the infections in India are steadily ticking upwards, perhaps not at the pace that we hope that is not at a very high pace, but this is where we are at the moment. 694 cases is where we are in terms of the cumulative cases so far. And if we can just now look at the breakup just for today, get that graphic up on the screen, then we'll have some idea of how it is actually played out on a day-to-day basis. 694 is the total amount of cases that is starting from the 1st of March, end of February, 1st of March is when the cases started. But at 694 cases, we have a situation where we've had a mega lockdown, and that has led, as these visuals that we just played a short while ago show you, of millions of people being displaced out of work, having to find their way home under a severe lockdown scenario, having to be beaten by the police, having to be humiliated. That's the question that many are raising, that while it's certainly important to have lockdown to curb activity, to curb contact, what is the economic cost it has come at, and what is the human cost it has come at? In a way, it almost seems that the health crisis has taken a secondary step to the humanitarian crisis. And those are the questions that are being raised. I'm joined by Vikram Patel. He is a professor at Harvard. He's someone who's worked in the field of public health for many years. He joins me from Goa via Skype. Thanks very much indeed, Vikram, for joining us. Now, you wrote a very powerful piece in the Indian Express today where, and I don't want to oversimplify it, but you did raise questions about, given the extent of the virus in India compared to other parts of the world, have we overreacted with this lockdown?
So, Vasu, thank you for bringing me on your show. Let me first of all say the reason I wrote that piece was because I was one of the people who experienced what you just showed in that video. To my great horror, as a member of the elite, I've never been lathi charged before. But I had turned up at the local grocery store on the night of the Prime Minister's speech when he announced the lockdown. And I realized with my wife that we had 3 hours left to stock up on food. We hadn't resorted to panic buying because we had been told not to panic buy. And then I was suddenly realizing that for 3 weeks we may not get any food. And so we lined up with 50 to 100 other people outside 2 half-shuttered stores in Goa, of all places, which at that time had 0 cases. And we were lathi charged by the police. So I have to tell you, it's pretty rattling as a member of the upper classes to be lathi charged. And I kind of realized at that point what the vast numbers of people in our country have to live every single day. It really brought home to me the state of social services and governance in many parts of our country. But anyway, let me turn to your particular point. I don't want to really question any longer, whether or not we have gone too far with the lockdown. It's happened now. I may have disagreed with the lockdown policy, but to be honest, I thought the government had been handling the crisis extremely well in the first 4 to 6 weeks, with all the contact tracing, the quarantining, the stopping of international travel, and so on.
Sure.
I think now is the time for us, Vasu, to be quite honest, to respond to the lockdown with humanity. So like the images that you showed are no longer going to occur in our country, and that in particular, the vast majority of our people who live day to day are going to have economic support to ensure that their livelihoods that have been just evaporated overnight are not going to damage their health.
Okay, but Vikram, at the same time, while you say that the lockdown is upon us, I think it is still important to consider the degree of it from the point of view of someone like yourself, because you're a health professional, so you have a view on this. Now, you write in the Indian Express that one must wonder whether, given there was no evidence of widespread community transmission, we might have staved off the worst without a sledgehammer approach, which no country at the stage of the epidemic we are in has imposed.
Vasu, unfortunately, the last bit of your comment didn't get through to me. But I'm assuming you asked me to comment on what I just wrote in the newspaper this morning.
Yes.
And I think what I wrote is what I stand by. I do believe that many other countries in the east of Asia have shown that one doesn't need a nationwide lockdown. In fact, we're the only country that has had a nationwide lockdown. But I want to stress once again, it's happened. And as a responsible citizen, I think it's really time for us to show solidarity. Really, I feel this is the time when our country needs solidarity.
Okay.
You may or may not agree with the policy,
okay,
but the horse is bolted. And, now it's time for us to think about how we communicate this particular message to everyone in this country in one voice,
right,
and minimize the inadvertent damage that the lockdown could potentially pose to the masses of our people who are facing penury.
Okay. Vikram, stay with me a second. I also want to just widen this a little bit, and I want to bring in others on the panel. We have with us Sunita Reddy, Managing Director, Apollo Hospitals is with us. Dr. A. Velumani, MD and CEO, Thyrocare, which is one of the private labs that has actually been given permission to test for coronavirus in India. And also Ramesh Hariharan, CEO, Strand Life Sciences, Adjunct Professor at the IISC, Indian Institute of Science, in Bangalore. Now, I think the question that really, in a sense, that what we are sort of pivoting on is that so much of the government's response is based on an assessment of how bad the problem really in India is. And over that, there continues to be a fairly intense debate, especially over the fact about whether the numbers are still conservative in India, thank God and touch wood, but is that realistic, is that not realistic? The lockdown almost seems to suggest that the government had a sense that perhaps the numbers are much higher or could project it to be higher, and we had to hit hard. But the problem with trying to establish that is the question of testing and whether people are being tested enough, and are they even willing to be tested. Mr. Velumani, you're with us.
Yes.
And
go ahead.
You are, Thyrocare, you are one of the agencies that is allowed to test, and you put up quite an extraordinary post about your experience of actually testing. And I'll try to see if I can get that post up on screen to give you a sense of what you said, where you basically said that nobody wanted to actually come forward and be tested. Thousands signed up, but only 3 came forward because they were so scared of the social stigma associated with testing.
Yeah. There are 2 things which are major limitations. Number 1 is people felt that it will be done free of cost by government. So many sent a message. When we explained them, it would cost 4,500. Almost 90% said no, then in that case we are not interested. But subsequently, on persuasion, a good number agreed to undergo testing till they understood the technician will come with a protection gear.
Okay.
That gave them a worry, because it will come to the society building with an ambulance, and somebody will get down and somebody will come to the corridor with a kind of dress which probably they felt they will be discriminated in the society as a, one who is fit to reside there. So drastically the numbers came down. Finally, the first day only 3 we could do. Yesterday we could do around 12. Today we have collected around 40. So slowly the numbers are growing, but there are challenges in people truly looking at as solution.
This is actually something which is quite remarkable, that what you wrote about. I mean, now the numbers are going up, so thankfully some of that stigma is wearing off. But you wrote there's unprecedented panic and fear in the public. As you said, only 30 out of 5,000 finally were willing to pay the 4,500 rupees per test. 90% requested that those who come to collect the test come without protective gear. Finally, only 3 were tested. Bikers were stopped. 20% had to go back. This is a serious
That
problem.
is due to lockdown.
That is due to the lockdown.
That is a big challenge. In fact, we had to go for a collection using a government ambulance. When ambulance, once it comes to the society, there is much more panic.
Right. But at the same time, the fact that people were asking you to send people to come and collect tests without protective gear because they didn't want their neighbors and others to know, I mean, that's
a stigma.
That's the stigma. That's quite shocking. But given that, Ramesh Hariharan, you've been writing about this, and you've been also, in a sense, trying to do projections and models of the scale of the virus in India. What do you make of where we stand with the disease? Are the conservative, are the numbers that we know of as being tested and reported by the ICMR, are those realistic, or again this constant sense of, is there a much bigger concealed number which merits such a severe lockdown?
There is no definitive answer to that, but what we can guess from estimates, a couple of different estimates, which I did write about in my blog. One is estimates made in China on, the numbers that were the actuals reported by the government and various models that used, travel incidences within China, and estimated that the undocumented number is perhaps 6 times the documented number.
Right.
That's one data point. The second is, the government, cognizant of the fact that there might be community spread, they went and tested, randomly picked up about 800 and something samples and tested them. And if you do the statistics on that, that tells you that if there had been many more than like 8,000 incidents in India, then they would have shown up in that random sampling, which they didn't.
Right.
So from both those estimates, my guess is that there are probably a few thousand cases, not few tens of thousands of cases. So it's still within perhaps control, but the rate of growth is in 6 days it doubled or even less. So there's cause of concern, but that would be the range.
But at the moment you're saying there would be a few thousand cases, not tens of thousands.
No, that's from the 2 estimates that I gave you. That's what I can infer. But again, nobody knows this answer because not enough testing has been done.
Right. But Ramesh, do you then feel that this kind of severe lockdown is merited?
Well, only to the extent that the rate of growth is dramatic. So if you look at how it's grown in areas that it has gone out of control in, it's grown in such a way that the few thousands next month can become 100,000. The month after, it can become 1 million. So now we don't know whether that would happen, whether the Indian conditions are conducive to that or not, whether, those are things we don't know. But in anticipation of that, perhaps given, it's one strategy to buy time to get our act together.
Sure.
Of course, the cost is tremendous, and it must be not an easy decision.
Right. Sunita Reddy, what do you make of it? Because there is this problem where we fear, we hope this is not the case, but because of the kind of social backlash that's also now becoming associated with this, we're just putting some videos up of how airline crews, are facing stigma from their neighbors. We have doctors, we are hearing so many cases of doctors actually facing stigma when they go back to their homes from their neighbors, abusing them, all of that. That could actually lead to people even concealing symptoms and trying to hide the fact that they have perhaps not even the disease, but symptoms, where you then don't get a clear picture of the extent of the virus.
So I think you really need to weigh the options. One is, is the social stigma more important than actually ring fencing the virus?
Right.
I would think that this lockdown was absolutely necessary, and it is very necessary to go ahead with the testing. Because if you look at the way this spreads, first it was 1 person infecting 2, but there are instances when 1 person actually can infect 50. So if you look at the John Hopkins study that was done with regard to India, it clearly shows us that these 3 weeks of isolation are completely necessary for us to contain the spread of disease. So I don't think the social stigma is,
Right.
Yeah.
Even not so much the social stigma aspect of it, but just the kind of displacement and the kind of economic turmoil that it's caused. So again, that delicate balance?
Surely, you know, yeah. So balance is important, you know. It is costing the government 9 lakh crores every day that we shut down. But this is what they are willing to invest into and what they are willing to fund in terms of the lockdown. So you can understand how important it is for the government to enforce this lockdown.
Right.
And being in healthcare, I think, you know, we believe the self-isolation is the best way to contain it.
Right.
Next will come testing, and of course the third, which is finally getting admitted into a hospital.
Okay. Vikram, you spoke of the need for compassion at this time of a lockdown, but there's one thing to expect compassion of the state, and you know, we're repeatedly putting pressure or holding to account the police force for the kind of brutalization that we're seeing that they're doing, particularly of the poor. But there's also what we just spoke of, that there's certain lack of social empathy, that people are turning against others, this kind of stigmatization of health workers, airline professionals, so on and so forth. That's regrettable. How do we, firstly, have you seen anything like that, something of this nature in a public health crisis, and how do you tackle it?
Yeah, actually, Vasu, first of all, I have to say this is not the first time diseases, infectious diseases in particular, have been stigmatized. The best example in recent history is, of course, HIV/AIDS. And I think if we circle back to the HIV/AIDS history, you will all remember perhaps that in the late 1990s, we had exactly the same kinds of fears that were being expressed about India being engulfed by an HIV/AIDS pandemic. I have very good memories of this, of course, that, you know, tens of millions of Indians are going to drop dead because of this disease that was ravaging Southern Africa, not keeping in mind the completely different context and recognizing that infectious diseases do not spread in exactly the same way in different contexts. Even in India, they actually don't spread. Consider the Nipah virus that only stayed in Kerala. So I think I remember that very well. And when you sow the seeds of fear, that there are people who are infected with a disease and that the impression is that you're going to get this disease from them, then automatically it is just a natural human reaction that you begin to fear those who might carry the virus. This is not the first time it's happened, and tragically it's happening again right now.
And what do you think is the way to try to prevent this? Vikram.
Well, Vasu, this is, you know, in a way, as I said, the horse is bolted. You know, we have inadvertently created a mass panic in our country today. Now, as I said, and I say it again to all my fellow panelists and to everyone, that we need to speak with one voice. And I think we really do need to convey the issue of risk, first of all, very, very clearly.
Right.
As a matter of fact, out of every 100 people who contract this virus, at the most one will actually die. About 5 will suffer a serious illness. I don't even think people understand what that means in terms of risk to yourself. The real risk that we need to be conveying is to the elderly people. And to the healthcare system, we have a responsibility to ensure that the elderly and the healthcare system in our communities are not overwhelmed. And so therefore, we need to protect ourselves, and we need to make sure that we are abiding with the good practices that we all are told we should abide by, such as, for example, physical distancing.
Right.
We need to invoke, Vasu, our natural sense of compassion, of altruism, of caring for one another, rather than the fear of this dreaded virus that then makes us fear other people.
Okay. Yeah, that's true. It's interesting because on one hand, one would assume that this is a virus that actually, you know, that the scale of it is going to lead to empathy, but then it also requires you to distance from your fellow citizens, and so therefore it actually provokes a very different reaction. But before I end, I just want to ask Dr. Velumani that, Dr. Velumani, because it's coming back to the question that it's so crucial that we really have answers to this only through testing. Do you have enough kits?
Yeah.
That's not a problem?
Yeah, let me tell you, the number of infections could be far, far high, but the number of deaths are very low. That also gives us a feeling that Indians probably have a better immunity, and the deaths are not truly commensurate with the number of infection. This is what I would say in terms of infection.
Okay.
Coming to testing kits, I don't think that's a limitation. There have been many kits now approved. There are many people giving competitive quotes, and there won't be any problem because the DGCA has approved the landing of kits to the country.
Okay. That's good to hear. And fingers crossed, we hope your theory is right about Indians and their famous sense of immunity. Thank you all so much for joining us. That's all the time we have on the show. Thanks so much for watching. Good night.